Hello and welcome to Pediatrics for Mothers. Today we're going to talk about a common concern for parents, the common cold in children. As a mother myself, I know how stressful it can be when your child gets sick, but rest assured there are many things you can do at home to help your child feel better. In this video, we'll be discussing the symptoms of a common cold in children, home remedies, and over-the-counter medicines that can be used to help relieve symptoms. We'll also talk about when it's important to seek medical care for your child. So let's get started. A common cold is a viral infection that affects the upper respiratory tract. It is caused by a variety of different viruses, and there is no cure for the common cold. Treatment typically involves managing the symptoms of the illness. Colds are spread from person to person through respiratory droplets that are released when an infected person coughs or sneezes. The virus can also be spread through contact with surfaces that have been contaminated with the virus. To prevent the spread of colds, it's important to practice good hygiene, such as washing your hands frequently with soap and water, covering your mouth and nose when coughing or sneezing, and avoiding close contact with people who are sick. It's also a good idea to disinfect surfaces that may be contaminated with the virus, such as doorknobs, light switches, and toys. Additionally, it may be helpful to boost your immune system by eating a healthy diet, getting enough sleep, and staying physically active. The symptoms of a common cold in children typically include a runny or stuffy nose, cough, sore throat, and sometimes a fever. Other symptoms may include headaches, body aches, and general feelings of fatigue. These symptoms usually develop within a few days of exposure to the virus, and they may last for several days to a week. In some cases, the symptoms may linger for up to 2 weeks. It's important to note that these symptoms may vary from child to child, and some children may experience more severe symptoms than others. Additionally, some children may be more susceptible to complications from the common cold, such as ear infections or pneumonia. If you're concerned about your child's symptoms or if they seem to be getting worse, it's always a good idea to consult with your child's pediatrician. Home remedies for common colds in children: rest. Encourage your child to get plenty of rest, which can help their body fight off the virus. Hydration. Make sure your child drinks plenty of fluids, such as water or juice, to help prevent dehydration and loosen mucus. Humidifier. Using a cool mist humidifier in your child's room can help moisten the air and relieve nasal congestion. Warm baths. Giving your child a warm bath can help to ease body aches and relax them before bed. Honey. Honey can be a natural way to soothe a sore throat, but it should not be given to children under 1 year of age due to the risk of infant botulism. It's important to note that over-the-counter cold and cough medicines are not recommended for children under the age of 6. If your child is experiencing severe symptoms, it's important to talk to your pediatrician about the best way to manage their symptoms. Over-the-counter, OTC, medicines can be used to relieve cold symptoms in children, but it's important to use them according to the instructions on the package. It's also important to note that some OTC medicines are not recommended for children under a certain age. Acetaminophen or ibuprofen can be used to help reduce fever and relieve pain in children with a cold. However, it's important to use the correct dosage based on your child's weight and age, and to never give them more than the recommended dose. Cough syrup can be used to help relieve coughing in children, but it's important to choose a cough syrup that is appropriate for your child's age and to use it according to the package instructions. Saline nasal spray can be used to help relieve nasal congestion in children, and it is safe for children of all ages. However, it's important to use the correct dosage and to avoid using the spray for more than a few days in a row. It's important to always consult with your child's pediatrician before giving them any medication, including over-the-counter medicines. Your pediatrician can help you determine which medications are appropriate for your child's age and symptoms, and can provide guidance on how to use them safely and effectively. While most cases of the common cold in children can be managed at home, there are some situations where it's important to take your child to see a doctor. These may include if your child has a high fever, severe cough, difficulty breathing, or other concerning symptoms. Other reasons to seek medical care may include if your child is not eating or drinking enough, if they seem particularly irritable or lethargic, or if they are not getting better after several days. It's important to trust your instincts as a parent and seek medical care if you are worried about your child's health. Your child's pediatrician can help you determine the best course of treatment based on your child's individual needs. Finally, it's important to remember that while the common cold is a relatively mild illness for most children, it can be more serious for some, particularly those with underlying health conditions or weakened immune systems. If you have any concerns about your child's health, it's always a good idea to seek medical care. In this video, we've talked about common colds in children, including what they are, how they're spread, and typical symptoms. We've also discussed ways to help relieve symptoms at home, including rest, fluids, humidifiers, warm baths, and honey. Additionally, we've talked about over-the-counter medicines that can be used to relieve symptoms, such as acetaminophen or ibuprofen, cough syrup, and saline nasal spray. However, we've also emphasized the importance of using these medicines according to the package instructions and consulting with a pediatrician before giving them to your child. Finally, we've discussed situations where it's important to seek medical care for your child, such as if they have a high fever, severe cough, or difficulty breathing. Thank you for watching this video on common colds in children. Remember, while it can be scary when your child gets sick, there are many things you can do at home to help them feel better. Always trust your instincts as a parent and seek medical care when necessary. By working together with your child's pediatrician, you can help keep your child healthy and happy.